Hi folks, I have received a lot of questions concerning pleurisy, pleuritis. Around about 10 principal questions I will answer now. So it will be helpful not only on your big exams, on your board exams, and MCQ questions, for example, MCQ tests, but as well as in your future medical practice. So take your pens, papers, and let's go, my beloveds. Concerning pleurisy or pleuritis. So pens and papers to make the notes, huh? So, my beloveds, pleurisy, it's a symptom, not a diagnosis at all. Okay, so pleurisy or pleuritis, it's not a disease on its own. It's not a disease on its own, but a manifestation of underlying condition that causes inflammation of the pleura. Pleura, it's a membrane surrounding the lungs. It's commonly seen in infections, viral, bacterial, or tuberculosis, autoimmune diseases, you name it, lupus and rheumatoid arthritis, some malignancies, and, for example, as well as in chronic heart failure. So what is clinical importance of that? Recognizing pleurisy means looking for the root cause that provoked the problem. Okay? Failure to do so can delay diagnosis, correct diagnosis of serious conditions like tuberculosis, heart failure, lung cancer, etc., etc., etc. Okay, so it's not a disease, it's a symptom. Then, the classic symptom is a sharp pleuric chest pain, if it's a so-called dry pleuritis. Patients describe the pain as a sharp, stabbing and worsened by inspiration or coughing. The hallmark feature is pleuritic pain when lying on the affected side, auto-splinting. Okay? If it's a dry, of course, if there is no liquid there. So clinical importance of that, pleuritic pain is a red flag symptom, differentiating it from a cardiac pain, for example, chest, you name it, angina, for example, or musculoskeletal pain is crucial to avoid misdiagnosis. So we know how angina works. Triad pain beneath the sternum, so retrosternal pain provoked by physical exertion, and pain cancel when you take nitroglycerin or you stop the pain. It's classic triad of angina, classics, heart pain, coronary artery disease pain, angina. Here, no, pleuritic pain, relief when lying on the affected side, auto-splinting. Then, viral infections are the most common cause of pleuritis. The majority of pleurisy cases result from viral infections. Influenza, coccidiovirus, adenovirus. Other common infections caused include bacterial pneumonia, pneumococcal, staphylococcal, tuberculosis, and fungal infections. What is clinical importance of that? In viral pleurisy, supportive care with NSAIDs is often enough, non-steroid anti-inflammatory drugs, while bacterial causes may require and must require antibiotic therapy, correct antibiotic therapy. Okay, then, pleurisy can be a sign of an autoimmune disorder, autoimmune condition. Conditions like a systemic lupus erythematosus. Yes. Rheumatoid arthritis and vasculitis can present with pleuritis. Lupus pleuritis often causes serosanguinous, or exudative pleural effusions. So what is clinical importance? Clinical issue. It's that if pleurisy occurs in a young woman with joint pain, consider lupus. Especially young ladies with a joint pain. Autoimmune markers should be evaluated. ANA, rheumatoid factor, anti-DS and DNA, etc. Okay, so be careful on the exams concerning these problems, these questions. Pulmonary embolism can mimic pleurisy. Another point. One of the most life-threatening causes of pleuritic chest pain is pulmonary embolism. In pulmonary embolism, pleurisy is often accompanied by tachypnea, hypoxia, and hemoptysis. What is clinical importance? If a patient has risk factors from thrombosis, immobility, recent surgery, cancer, pregnancy, always rule out pulmonary embolism using D-dimer, previous lecture, D-dimer testing, or computed tomography, pulmonary angiography. Then, friction rub. Friction rub is a characteristic clinical sign. Pleuritic friction rub is a harsh, grating sound heard on auscultation when inflamed pleural layers rub against each other, like walking on the snow. It's best heard during inspiration and expiration at the lower lateral chest wall. What is clinical importance? This sound is a diagnostic of pleuritis and differentiates it from conditions like pericarditis, which is a friction rub best heard on the left sternal border. Then, pleural effusion often accompanies pleurisy. Pleural effusion. Inflammation of the pleura can lead to pleural effusion, fluid accommodation in the pleural cavity. Effusions can be transudative, for example, heart failure, cirrhosis, or exudative, infections, malignancy. Trans and exuda. Transudative, heart failure, cirrhosis, and exudative, infections, malignancy. Clinical importance. If an effusion suspected, thoracentesis should be performed to analyze the fluid to determine the cause. Tuberculosis pleuritis is a great mimicker, my beloveds. Tuberculosis can cause chronic pleurisy with exudative pleural effusion. Tuberculosis pleuritis often presents with low-grade fever, weight loss, and night sweats, mimicking malignancy. Clinical importance. In high-risk patients, history of tuberculosis exposure, immunosuppression, pleural fluid ADA, adenosine deaminase, and PCR for Mycobacterium tuberculosis should be ordered. Next point. Malignant pleuritis suggests advanced cancer. Pleural involvement is common in lung cancer, breast cancer, lymphoma, and mesothelioma. Malignant pleural effusions tend to be recurrent and hemorrhagic. And clinical importance: if pleurisy is associated with persistent pleural effusion, weight loss, and dyspnea, consider malignancy. Actually, very, very, very bad sign. Pleural cytology and biopsy can confirm the diagnosis. And finally, NSAIDs. Actually, we mentioned above, but non-steroid anti-inflammatory drugs. For uncomplicated pleurisy, NSAIDs, non-steroid anti-inflammatory drugs, ibuprofen, you name it, indomethacin, etc., and so on, are the most effective treatment as they reduce inflammation and pain in severe cases. Only in severe cases, steroid may be considered, especially in autoimmune pleuritis. Actually, it works very good in autoimmune pleuritis. Corticosteroids works very good in all autoimmune disorders. Clinical importance: if pleuritic pain persists despite NSAIDs, non-steroid anti-inflammatory drugs, reevaluate for serious underlying causes like pulmonary embolism, tuberculosis, malignancy, or something else. So much, guy. So largely sufficient for your remembering. for your big exams, board exams. Re-answer, relook this video, my beloveds. And once again, my beloved, don't forget to follow and subscribe my Dr. Y, not only YouTube channel, it's okay, but also my private Dr. Y Telegram channel, where you can find all these tricks, cheat sheets, students' cheat sheets, and other interesting cases, clinical cases, surprises, gifts, why not? So it's all in my private Dr. Y Telegram channel. How to find this Dr. Y Telegram channel? Tap in searching mode Dr. Y, like question, WHY, why it's me, Dr. Y. It's a bot. Click start and choose plan that suits you. And we will talk toe to toe. Stay blessed.